Good morning, everyone. I'm Bill Miles with the Hilton Head Island Bluffton Chamber of Commerce, and we're delighted to have you joining us again for our weekly Chamber Community COVID Teletown Hall. We continue to bring together a panel of leaders in healthcare, government, and business to help us navigate the pandemic and put facts over fear. The Chamber held the first task force meetings yesterday for the Path Forward Readiness Plan. This week, close to 150 community members are coming together with one goal, which is to develop the startup strategy for business as we work incrementally to safely and jumpstart our economy. Ray Warco, an island resident for 33 years and businessman on Hilton Head Island and in Bluffton for many, many of those years, has agreed to chair the task force. And I'd simply like to share what those 7 task forces are with you. We have small business, retail, faith organizations, restaurants, lodging, early childhood, recreation, and attractions. And it's an ambitious plan. If you'd like to learn more, you can go to our website, which is thepathforward.org. And I repeat, thepathforward.org. And if you'd like to offer input on the Path Forward Readiness Plan, I'd ask that you please email us at pathforward at hiltonheadisland.org. That's pathforward at hiltonheadisland.org. And please know that we want and sure value and appreciate your input. We surveyed over 3,000 members of our business community again this week to get their feedback on 2 questions related to reopening. We asked the question, are you in favor of reopening beach access with social distancing guidelines in place? 75% of those respondents said yes, which is up 23% from last week's response. When we ask a new question this week, are you in favor of easing dining restrictions on restaurants with proper social distancing? The majority of respondents, 67%, said yes, with the vast majority of those suggesting a starting date of May 8th. Our business community wants to get back to business with the input of residents, business leaders, and our government officials. We're rolling up our sleeves to provide recommended guidelines to safely get residents back to work. So that's what's happening here on the local front. And we also know there's a lot going on in Washington right now as it relates to what's next for business. There's certainly no shortage of confusion related to the PPP, the CARES Act, EIDL, and other legislation coming down the road. And to get us started this morning to talk about it, we're fortunate to have Tom Sullivan, the Vice President of Small Business Policy with the U.S. Chamber of Commerce, back on our call this morning. Tom, thank you for joining us again, and welcome back.
Bill, thank you for having me. Really very, very impressive about how you are bringing the community together to look at return to work. We're doing the same at the U.S. Chamber of Commerce, and will benefit tremendously from the task force work that you're doing. You know a lot better than I do that we learn tremendously from the experiences and the successes, and sometimes even some of the failures from some of our local, state, and regional chambers of commerce. So thank you for being such a leader in this effort. I'll give you just a quick update on some of the stuff going on with federal loans. You mentioned the PPP loan. As many folks know, and certainly your membership who has been as dialed in to this as anyone, 13 days ago, the Paycheck Protection Program loans ran out of money. That money was the $349 billion that had been designated as part of the CARES Act. The small business demand for those loans was unbelievably high. I believe the final tally of that first tranche of money was over 1.7 million small businesses applying and receiving funding from that. So thanks to the Hilton Head Island and Bluffton Chamber of Commerce and over 2,000 other chambers of commerce and other associations banding together, we pushed Congress to restore funding for both SBA disaster loans and for the PPP loans. We were successful that on Friday, Congress did pass, the president signed into law an additional an additional $60 billion for SBA disaster loans, and an additional $310 billion in PPP loans. As of yesterday, as far as the PPP loans go, $50 billion has been loaned. That equates to over 450,000 small business applicants being funded through over 4,000 lenders. SBA is trying to do it a little bit differently this time. They're trying to space out the applications. They have what are called batches. If there are any bankers on the line, they know the technical details a lot better than I do. The concept was if you allowed only a certain number of batches per bank, then the system wouldn't get overloaded as quickly, which unfortunately is not the way it worked out. The system still got overloaded very quickly. But B, it was the idea that if you were the most technologically advanced bank, and you wouldn't be able to gain an unfair advantage over a bank that maybe wasn't as technologically advanced. And so the concept was if we have these batches with a maximum number of loans per hour, then it would space out the applications and kind of spread the loans across a greater portion of the small business community. Bill, I certainly don't have to tell you, but I'll mention that demand continues to be at an all-time high. So right now, not only are we making sure members like your membership are informed with the status and the status of SBA loan program that also ran out of money, the disaster loans, that portal has not opened up again yet. So the SBA disaster loans, not open yet, but the PPP loans, they are open. I talked with a small business owner late last night that had just received word from a bank that he was accepted. So there are some banks that are still accepting applications, fewer and fewer, unfortunately, because the demand is so high, but there still are some. And this is where the power of a local chamber of commerce is so valuable. I have never met a chamber of commerce who didn't have leadership that is either the branch manager of a national bank or a CEO or senior officer in a local bank. And that power of community certainly is worth the price of admission right now, because those networks are what are allowing small business owners, A, to learn more about the program, but B, and more importantly, to get the capital they need to survive.
Tom, thank you. And we appreciate that update. We know that what you're doing and what the U.S. Chamber of Commerce continues to do is so important to getting the country back up and running again. We appreciate your support, and thanks for dialing in this morning.
Thank you, Bill. We appreciate you.
Thank you. As we move on to our next speaker, I would encourage people that on the chat box there, if you have questions, to send those in. We're going to be following Tom with Fred Green. And Fred is the president and CEO of the South Carolina Bankers Association. And Fred, welcome to the call. And as Tom was talking a little bit about batches, I'm sure that's something that you'll be able to address during your update.
Thank you, Bill, and thanks for including me again. If Tom's still on the line, Tom, you did a good job of explaining the PPP program and some of the issues that I guess the banking industry and all small business are facing with it this week. So I'll just kind of pick up with where Tom left off and kind of give everyone an update. As he mentioned, the program on the second tranche started at 10:30 a.m. Monday morning, and very promptly at 10:30 a.m. Monday morning, the entire SBA system crashed, and it was down for hours. And I guess it was related to the high volume of applications being or attempting to be pushed through the system throughout the country. On the last call, I mentioned some statistics on the number of applications that did not make it through the system on the front end, or the last $300+ billion that were sitting on bankers' desk waiting for the second. So presumably every bank throughout the country had a stack ready to go. And as I said, the system just crashed on Monday. It stayed down most of Monday. It started picking up a little bit of traction late Monday. Yesterday was spotty, down most of the day, very, very slow. Banks that had been able to process per operator maybe 20 an hour toward the end of the front. The first PPP had 7 or 8 operators not getting in but one every 2 or 3 hours. So again, you can see the huge difference in volume that's going through the system. I understand this morning on a few phone calls I've had prior to this one that the system is showing some additional speed today. But in talking to a number of community banks that were very successful on the first PPP program relative to where they are this one, they're way behind in terms of the numbers they were able to process. So my message to the audience, Bill, is for the small business owners to just be patient. Your bankers are trying everything they can to get your applications processed. But again, there's a huge, whether it's a bandwidth problem or whether SBA is just trying to cycle down and not allow many through, I really don't know. They've kind of issued 2 different statements on it that conflict with each other. So just be patient with your banker. They're doing everything they can. I talked to a number of them who were still on the 24/7 shift as of even last night, trying to get through some in the wee hours of the morning when maybe there were less operators. So the last I heard, and kind of national headlines this morning, is through the first 2 days, there were 500,000 applications approved, representing about $50 billion. So there's a little less than 300 billion still remaining. And Bill, I'll be happy to answer any questions as well.
Thanks, Fred. And one question for you comes from Kim. And Kim is asking, when do they expect the PPP funds to run out again this time?
Well, that's a great question. If you had asked me that same one last week before we hit the problems that we did when this one opened, I would have said probably by now. And that's just because of the high volume of applications that had not been processed. Because it has gone much slower than anyone could have imagined, I imagine it'll probably be similar to the first one, and that's somewhere in the neighborhood of 8 to 10 days. So unless they really pick up speed, it'll probably last beyond this week and maybe even early into next week.
All right, thank you, Fred. The next is more of a statement than a question, but somewhat of a question. It says, when is Fred going to retire and come back to Hilton Head? We miss him. That's him, a longtime chamber supporter and a longtime member. So come back home, Fred.
Well, I wish I could. Thank you, Bill, and thanks to whoever sent that in. When things clear up and everything's a little more back to normal, I will stop by and see you and a number of old friends on Hilton Head.
Good. Thank you, Fred. And thanks for being with us again this week. I hope you'll stay on for a little bit. We have William Furman following you again this week, and then there may be some questions that William and you can answer together. William, welcome to the call. William's the senior area manager for the SBA.
Good morning. Thanks for allowing me on the call again this week. I think PPP has pretty well been covered. but a couple of things I would like to mention. So I'm going to be brief. We do continue to pause on new economic injury disaster loan applications. We do have a substantial backlog, and so SBA is trying to clear that backlog out before we start, a round 2 on the economic injury disaster loan applications. And these are the loans that come directly through SBA. And hopefully, my hope is that will happen in the next few days, but it's yet to be seen. So just pay attention to our website, sba.gov. There'll be information on that as far as those economic injury loans go. Couple of things we talked about the E-Tran system and some of the challenges we've had this week. One thing of interest that I saw yesterday was the fact that SBA did stop allowing robotic applications to be submitted. So, I'm not an IT person, but I think some of the larger lenders, Fred talked about entering them in batches, and that is allowed. But there's also software out there that was being used to robotically enter applications, and that was giving some of the larger banks an advantage. And so SBA did stop allowing the use of that. So I thought that was pretty interesting. The other thing that came out yesterday is that we have had a lot of press on some of the larger recipients. And SBA does require borrowers to certify in good faith that their PPP loan request is necessary. So that's been a requirement all along. But yesterday, SBA and the Treasury made a joint statement that all loans in excess of $2 million will be reviewed for eligibility following the submission of the loan for forgiveness. So just want the public to know that SBA and Treasury are both looking at that, and that these loans will be reviewed. And so I think we've pretty well covered this topic, but I'll be happy as well to answer any questions if I can.
Thank you, William. And first question comes from Tamara, and Tamara is asking when will the SBA disaster loan program open again?
Yeah, it is to be determined. We are trying to clear up that backlog. Quite frankly, SBA was overwhelmed by the volume of applications that we received in the economic injury disaster loan program. So trying to clean that up, get that under control, and then that portal will be reopened for applications.
Thank you. The next one comes from Linda regarding EIDL, asking if it's a loan or a grant, and how do you know which one it is?
Yeah, so it is a combination. We don't call it a grant. We call it a forgivable advance. And that is the first piece of the EIDL loan. That can go up to $10,000. It's based on $1,000 per employee. So if you have 5 employees, you'd receive $5,000. If you had 10, you'd receive $10,000. If you have over 10, you're still going to receive $10,000 on that immediate advance. And after that, then it comes the loan piece of that program, which it is a loan. It is required to be repaid. This is the only time SBA actually makes direct loans to small businesses. And the loan comes with an attractive interest rate, 3.75%. The term can actually go up to 30 years. And in this situation, SBA is deferring those payments for the first 12 months. So there are some advantages for EIDL versus PPP, although you can actually have both of them.
Thank you. Next question is from Courtney. Courtney is asking, when are the final guidelines going to be released regarding the forgiveness calculation?
I wish I could answer that one. I sure would like to see them as well. Some guidance did come out yesterday for reporting requirements for lenders. So I'm hopeful that in the track of things that will be one of the next ones. We have a lot of businesses that honestly need to know what the rules are, and hopefully SBA will be getting those out in the near future as well.
All right. Lori is asking this morning if we've been told we're approved, when will we see the funds arrive?
If you have been approved, your lenders, you should be hearing very soon from your lender. The lender does have 10 days to advance those funds.
Okay. The next question comes to us from Sean, or I'm sorry, from Alexis Shaw. We applied 3 weeks ago for idle and received a confirmation number, but nothing more. Is this normal?
It is normal. You will, right now they're running about 4 to 5 weeks. You really will not receive any other correspondence. The first thing you'll receive or that you'll notice is a deposit in your bank account. You'll receive the deposit. You will not receive an email. And then at a later date, you will receive an offer for your idle loan. So the first piece is the immediate advance. It's deposited directly in your bank. And then SBA will follow up with you as far as your loan piece of the idle goes.
William, thank you. That's going to be all the questions that we have this morning. Thank you to you and to Fred, and we appreciate you, and we'll talk to you again probably next week.
Thank you so much.
You're welcome. We're going to transition now to local government, and from Hilton Head Island, we have Mayor John McCann and Town Manager Steve Riley. Mayor McCann.
Okay. Good morning, Bill, and thank you once again for hosting this meeting. This is an extraordinary period for everyone, not least of which because we are just plain tired of it. It's only human nature to default to the negative adjectives, scary, tragic, confusing, devastating, maddening, and a 24-hour news coverage which doesn't really help us. We hope we can focus instead on the abundant positives in our immediate world. So heroes, the compassion, the generosity, the kindness, and so many are brought to strangers and loved ones alike. It is these traits and behaviors that have gotten us this far, and they are what will get us to the other side of this. Be safe, wash your hands, and God bless everybody. Steve?
Thank you, Mayor. I'll touch quickly. We had a town council meeting yesterday, as Bill already mentioned. He was one of the speakers. Jeremy Clark and Dr. Alan Bennett from the hospital also gave us an update. Staff gave an update about our plans for recovery, of which the path forward is part of that, and also not only how we hope to support the business community, but also how we hope to get town council back open and our boards and commissions back to meeting on a regular basis and getting back to our town business. But the big thing, of course, was a discussion about beach access points, public beach accesses, and town parks. And what came out of that ultimately was a compromise that opens this Friday Islanders Beach Park and Coligny Beach Park, both of those for at least the next couple of weeks, limited to island resident pass holders only. Staff is meeting, frankly, as we speak, to try to work out some of the details of how that's all going to function. Restrooms will be open. We will have staff out there. And we also made changes to both our emergency towing ordinance and our permanent towing ordinance so that we're prepared. If folks are parking illegally, parking where they're not supposed to be, we are prepared to tow. We hope to avoid that. We will have folks checking those backs of those cars for those stickers. And we're right now, there's not a good process to buy a beach pass. We're also meeting today to talk about how best to streamline what right now is a rather cumbersome process. But the other aspect the council did was on May 7th, we'll be opening two of our parks, Jarvis Creek Park on the north end and Crossings Park on the south end. No team sports allowed. Recreation equipment, playgrounds, that sort of stuff that's still under the governor's order for no access will have signage or will otherwise be restricted from use. And then council agreed to meet on May 12th, and at that point to review how this is going and how we might begin to open up the rest of the beach access points, transition out of this beach pass holder only restriction, and then talk about the rest of our parks as well. And happy to answer questions about any of that. The other thing I want to say is we have a great opportunity through the federal government to change our community development block grant program to allow us to use those funds and some supplemental funds that are coming from the federal government to support the nonprofit efforts to serve the needs of low and moderate income households. That plan of action is out for public comment right now. You can link it to our webpage. That's through Friday, and we hope to move rather quickly to get council approvals. And then we are going to be contracting with the Community Foundation of the Low Country, who knows way more about this than my staff frankly does. And we'll start to try to push those dollars out to the community to do some good. That's all I've got, Bill. Thanks.
Thank you, Steve. Thank you, Mayor. One question we had from Maggie, and Maggie is asking about with the beach partial reopening, are dogs going to be allowed for exercise purposes?
Yes, we haven't changed our dog regulations. I can't ever keep them all in my head, but I would urge anybody to keep their dog on a leash during this time. Lots of concerns about dogs and interactions that result when dogs get away. So yeah, take your dog for exercise, but please keep them on a leash.
Okay. Another question is, let me just see here. What is the status of the tennis courts and golfing? Let's see, Jim is asking, what is the status of tennis courts and golfing use under the current rules?
My best answer might be danged if I know, but I understand that golf courses generally are operating with social distancing. I know that U.S. Tennis Association had at one point a few weeks ago recommended shutting things down, but I also understand that at least one operation and one PUDs is getting ready to reopen based on some new guidance from USTA. So we are not at this point reopening any of the town tennis courts, but in the private clubs, I would urge you to reach out and contact the management there.
Thank you, Steve, and thank you, Mayor. Also, to answer that question a little bit later on in the conversation, we'll have Dwayne Parrish, and he'll be able to add some insight to golf and tennis as well. Mayor McCann, Steve Riley, thank you for joining us this morning. We're going to move to Mayor Lisa Salka and Mark Orlando from the town of Bluffton. I know they had a council meeting yesterday, and we look forward for the update. Mayor Salka.
Good morning, everybody. Yes, we've had several council meetings this month. It seems easier to do on Zoom than getting everybody together, but just a couple of things on yesterday's meeting. We extended our first of two readings, but I don't see an issue. We're extending our business license renewal date to August 7th, and we are not going to be charging any past due fees from the April 30th date to that. So I hope that helps some of the businesses who haven't paid yet to just give them a little more time. We did look at a ordinance, which I think now is turning into a resolution of really just enforcing what the governor has asked us to do and has issued in executive orders. And then we put together a best practices addendum to go with it. It's simple things, but we also think washing hands is simple, but that now is just almost a priority. So we're going to look at that Thursday. We're going to have another meeting tomorrow. I don't know where that's going to go, but we are discussing just kind of doing a reinforcement of the order. We passed, at some point this month, we passed a business resource guide for Bluffton, and I do appreciate what the chamber's doing and also what the state chamber's doing. So we're on it too on a government side, and it's a Bluffton small business support plan. It includes, I see John O'Toole here, very much a part of the Economic Development Corporation. It's a task force with our local schools and chambers and our businesses, really just to have a one-stop shop for resources and how the Don Ryan Center can help with any questions these small businesses may have. And if Mark is on, he can talk more about that. The thing with this group, we're all so different. Hilton Head, you cross over and you get to a point, you're in the town limits of Hilton Head Island. You're not like that in Bluffton. We are part county, part town, part Jasper, part Hardyville, it seems like. We have county parks. They have their own rules about opening. We have town parks. We are not opening our parks. It's too big of a risk not to keep them clean, and that is up to Mark. So Mark could change his mind today and open them. But for the time being and through the governor's order, we're keeping our town parks closed as well as our bathrooms. The ramp's open at Oyster Factory, but the parks around it are closed. So there's plenty of areas to get out and walk. We have pathways, you have your backyard, you have the county parks if they're open, but it's just our decision to keep them closed. And I hope everyone can at least appreciate it. They may not have to agree. I think that's all. I really enjoy being on these. If Mark is on, he can fill in some more, but I do appreciate everyone. Patience is thin, and I know that because my patience is getting thin. So please, I think the light is at the end of the tunnel. Thank you, Dwayne, for everything. We just have to start slowly opening like we slowly closed. And I look to the governor for his guidance on that and really appreciate his patience on this as well. So Mark, are you on? I don't know.
Yes, ma'am. Yes, ma'am. Good morning, everybody. And Bill, to really just echo Mayor Sulka and everybody else, thanks for leading and putting us all together. This is helpful. Really, there's only a couple things I can add on to what Mayor has given as a really good update. Council met, of course, yesterday, but they also met a few days earlier, and they passed what we're calling a small business resiliency plan, which ultimately puts our Don Ryan Center front and center and lead to really help the small business, the medium-sized business in our Bluffton town. We've got more than 3,400 business accounts. We have a new hub that's opened at Buckwalder Place, although ironically we can't move in just yet. But we've put together for our business community a survey through John O'Toole and the Development Corporation of Beaufort County. Mayor mentioned a resource guide. And through our hub, we've also started to establish some formal relationships and partnerships to allow the Don Ryan Center free membership for a year and free access to our Don Ryan Center for a year. And so I think that adds tremendous value, and it can help some small businesses really pivot, rethink, market, and address the COVID-19 crisis, not just from an SBA loan standpoint, but perhaps from a cash flow and an additional source of revenue in your business standpoint. Municipal court will commence electronically in May. We're thinking through that right now. Most likely the same way we're conducting council meetings, to a certain degree, we'll conduct our municipal court. And then everybody on the call and then some, I'll urge, and I'm sure you are all doing it, we have a staff task force put together for the town of Bluffton. It's just a task force of individuals, representation from each department to think through streamlining a reopen. And so what does that look like from a customer service standpoint, from an internal, external, public meeting standpoint, cleaning processes and protocols and all of those things? It's a daunting task. It's not just like we can grab whatever the state thinks we should do. Every organization is different. And so I urge everybody to put something like that together. We're starting to see municipalities somewhat open their doors in South Carolina right now. By no means am I trying to open our doors early May. Our services, especially if court comes back online, we will have 100% of our service delivery live, just different, electronically for the most part. But we are rethinking a lot of things. So stay tuned, and thanks for having me on the call.
Thank you, Mark, and thank you, Mayor. We appreciate your all's support being with us this morning. Let's transition now to the school district, and we're happy to have Dr. Frank Rodriguez with us, Superintendent of Beaufort County Schools.
Good morning. I just want to begin by thanking everybody for all that they're doing for our community. As you know, schools are closed for the remainder of the school year, as the governor announced that last week, and we continue to provide online instruction. So even though schools are closed for the remainder of the year, academic instruction is not. So we continue to provide online instruction as well as learning package for our students. In addition, we're continuing to support our students' needs with the meals. By the end of today, we should be right up against 250,000 meals. On another note, for the community's interest, our referendum projects continue on track. Our citizen-led oversight committee is doing a fantastic job and reviewing those projects. They haven't missed a beat or a meeting. They're Zooming like everybody else. We're currently making plans with principals for how we close out the school year safely. And during this time of year, schools usually have many ceremonial events, and we're looking at different ways to recognize our students. Our elementary schools, middle schools are looking at virtual ceremonies in order to do that. We are continuing to work with our high school principals regarding graduation ceremonies and what that will look like. We know this is certainly a very special time of year for seniors, and we want to make sure that we are able to do that. Later on this week, I'll follow up reaching out to our mayors in Bluffton and in Hilton Head. So I look forward to speaking with you. We will be releasing information on what those graduations will look like very soon. We're also looking at academic programs that we will be offering over the summer and what those programs will look like so that we can continue to support our students' academic needs as well through the summer. Safety is our number one goal for our students and our families and our employees. And we'll thank you for the opportunity to share with you.
Thank you, Dr. Rodriguez. We have a question from Deborah. Deborah is asking if there's any thought being given to starting the school year earlier in the summertime, since the children haven't been able to be back in the schools.
Yep, that is correct. There is some thought being given to that. Of course, we're all looking at what the economics is going to look like for us for the upcoming school year as well. So a lot of that is determined by what our budgets may look like. School districts are heavily dependent also on state and federal dollars. So a lot of those programs rely on that, but we are looking at possibly starting a little bit earlier. And it is possible that the state is considering using some of the state dollars that they receive to provide the local school districts in order to be able to do that.
Okay, Dr. Rodriguez, question from Jean. And that question is, what is the last day of school? And again, any discussion to end early, especially elementary, a lot of stress in the children and parents.
Yeah, so what we are doing is the governor has given a little bit of flexibility within those that last 2-week period. So we want to maximize our time academically and instructionally with the students. We know that in order to close out safely, it's going to take a little bit more time than it normally does, given the fact that we have to social distance as we do it. And so we're looking. We haven't set a final date yet, but we are looking around the 19th of May and into that following week in order to begin to collect some of the things that the school district needs to collect back from students, as well as, remember, our classrooms are like a time capsule. When school closed on March 15th, everything stayed exactly the same. And so we have to find a way to get our students back some of their own personal belongings, and that's going to take a little bit of time. So we're working through that.
Dr. Rodriguez, thank you for the update this morning, and thank you for your continued leadership.
Thank you.
We'll transition now to South Carolina Parks, Recreation, and Tourism. We're happy to have back with us this morning Dwayne Parrish. Dwayne.
Yes, good morning, Bill. Appreciate you having me on the call once again, and wanted to take just a moment to update everybody on where we are in regard to statewide tourism, some of the things going on not only at state level, but at some of the different local levels. I'll start with hotel status. Of the roughly 1,300 standard hotels in the state, 485 are closed as of yesterday. Of those closed, roughly half are in Myrtle Beach. Those are this Friday, the town of Myrtle Beach has voted to allow them to reopen starting Friday, along with the beaches as well. Obviously, most of those hotels will reopen with, as many of those that stayed open are, with new protocols in place in regard to cleaning and in regard to staffing and different things of that nature. Hotels in Myrtle Beach, again, comprise roughly half of that total. The beach opening with new protocols in place as well in regard to exercise, moving on the beach, limited time frames, and so forth. But nonetheless, the beach opening up in Myrtle Beach. In regard to occupancy, it has ticked up somewhat the last couple of weeks in the 20 to 25% range statewide. Much like I've stated before, those along the interstates are faring better than those in metropolitan areas. Also, those that are extended stay hotels like Residence Inn, short-term rentals, whole home rentals, those kinds of things are faring better than standard hotels as well. And just a reminder too that the governor's executive order is still in place and not allowing visitors to check in from New York, New Jersey, or Connecticut. You mentioned golf and tennis earlier. Just a reminder, the governor did not close golf or tennis anywhere in the state. Golf courses have a plan that they have submitted to Accelerate SC, the governor's statewide recovery task force, which I'll touch on in just a moment. But golf courses have sort of been practicing those things now already, turning the cup upside down, one person per cart, and the like. For the most part, those have done that. There are a few golf courses that have closed, particularly back in the Grand Strand area, due to just the amount of play on an annual basis done primarily by visitors is just simply not there. So not enough local play, but look for those to reopen pretty soon. Boat landings, as you're aware, opened up a couple of weeks ago. Social distancing has been pretty good there. Certainly people are much more aware of that now than they were when the boat landings closed a few weeks ago. So boats are now allowed out in the waterways as well as our lakes around the state. Speaking of this, the lakes around the state, our state parks will open this Friday. We'll open to day use visitors. We'll control population with the gates in regard to parking. Along those same lines, the South Carolina Recreation and Parks Association has recommended to county and municipal parks that they open around that same time frame of the first week of May, which is essentially next week, to take off some of the pressure of state parks handling all, because we know the cabin fever is high and people want to get out. But those parks will reopen. Camping in cabins in our hotel will all open up for reservations on May 11th. That gives us a time frame to sort of handle the day use crowds in the interim there. We do have some reservations that have been on the books for as long as 6-9 months that are in place from May 1st to May 11th. So there will be some people overnight in parks during those first 10 days of that. Along the same lines, our state welcome centers will reopen their doors on May 1st. We've always had them staffed ever since this started, the governor's state of emergency, with someone inside with a phone number that anyone could call in and be helped with service or whatever that may be. So the doors will actually open up. However, it'll look a little different. Our brochures will not be out for people to pick up, put back in the rack. We have new protocols in place in regard to cleaning bathrooms, in regard to cleaning counters. A lot of different things have changed in terms of what the new normal is for welcome center and for restaurants. I'm not going to talk about Triple P. That's the payroll protection program's already been covered. I mentioned Accelerate SC a few moments ago. So that group had its first meeting last Thursday. There are 25 people from around the state, different industries. We have 2 people directly from tourism, as well as the mayor of North Myrtle Beach and the mayor of Greenville on the committee. That is divided up into different subgroups. The one that's probably most relevant to tourism will be the response group. It has its first subcommittee meeting today at 2 o'clock. It'll be streamed live on SCETV. That group will address things anywhere from manufacturing, agriculture, and tourism. Some things such as taking employees' temperature when they come back to work in a manufacturing plant, taking employees' temperature when they come back into a restaurant, all of those sorts of things. Some recommended time frames for reopening restaurants. What does the new restaurant dining room look like? Those things in place. New cleaning protocols. Is outdoor dining open first and then indoor dining? A lot of those things will be discussed today at 2 o'clock in that meeting for recommendations to go up to the governor. The South Carolina Restaurant and Lodging Association has come up with a plan that, again, will be discussed within that context today. Along those same lines, hotel fitness centers. What do those look like? How many people are allowed in those? The swimming pools in hotels. How many chairs are around the swimming pool? All of those sorts of things, some of which will come up in discussion today in regard to what that looks like and the recommendations to the governor. You'll also hear about manufacturing, agriculture, healthcare, testing, all those sort of things will be discussed today. The 3 other subgroups within Accelerate SC, one met Monday. One met yesterday, and then today's response group, and then another group meets tomorrow, all at 2:00 each day. The governor and lieutenant governor, I expect them both to be in attendance today as well. So sort of look for those things to come through Accelerate SC, the governor's recovery team. And then in regard to media marketing for keeping sort of South Carolina top of mind, our recovery plan starts this Friday with paid media. Now, let me explain what that is. So right now we have tentative dates of May 1st and May 31st, what we call inspiration marketing. And that is, it's called Dream Now, Discover Later. And that's to keep South Carolina top of mind. Think of sort of scenes, low country scenes of the marsh, golf courses, but a lot of scenes without people in them. We'll move to the call to action phase right now. That's tentatively planned for June 1st. We would ask people to basically call to action, meaning ask them to come visit South Carolina. Obviously, that date could change based on what takes place between now and then, but that's certainly what we have set up for now. The good news is with electronic outdoor, which is, you've seen electronic billboards, with digital targeted marketing that can be targeted to particular states, we have the ability to be very flexible with that. And with today's world, we can target a specific state or even specific cities, or as the case may be in some states with a stay-at-home order, not target some states that have those in place. So it's sort of a nimble, flexible plan to be able to move forward and have people come back. And the last thing I'll close with is most people, I think, will be taking a trip in a car and not an airplane. So we'll target those drive markets in the Southeast. That's places like Charlotte, Atlanta, Raleigh. I-77's introduction into South Carolina allows us to go out to Ohio. That's a big feeder market for us in terms of the drive market. So that's sort of what we're looking at, is 80% of the people come into our state by car. We'll get more detail of that plan later, but we shared a lot of that with our partners around the state. And I think a lot of places will sort of mimic some of those same things, and particularly in regard to the drive market. But, we do move along, but as I've stressed to everyone in our industry, this really is a crawl, walk, run process. And we're starting the crawl phase here in May, as you'll see some things open up as we move forward, and hopefully the testing numbers will continue to decline. Pending any questions, Bill, that concludes my report.
Dwayne, thank you, and appreciate you being with us. I'd like to share with our listeners that you heard Dwayne talking a little bit about occupancy statewide for Hilton Head Island, and I'll give you the numbers from last week from our hotel segment. Last week we were running about 3.4% occupancy here, which is roughly about 124 guests, and you can compare that to last year at 82.4% occupancy, which is about 5,800 guests. So we've certainly, when the time is right, are looking forward to continuing to partner with PRT in our recovery marketing program as well. And Dwayne, we appreciate that, and thank you for all you do for the state of South Carolina.
Thank you, Bill. I appreciate the opportunity.
Talk to you soon. We're going to transition now to Dr. Michael Katka. Dr. Michael Katka, he's a medical consultant with the South Carolina Department of DHEC.
Thank you very much, and good morning. I appreciate the opportunity to speak again. Late yesterday, we reported the total number of people who have tested positive for COVID-19 in South Carolina as 5,735. This includes 26 new cases reported in Beaufort County in the last week, bringing the total to 259. The weekly total is a large decrease from the average of 75 cases per week seen at the end of March and the beginning of April. I was asked also to comment on two specific zip codes on Hilton Head Island, 29926 and 29928. The total cases reported for these two zip codes is 28 cases. Now, it should be understood, our estimates are that it's estimated that there's 172 actual cases there and maybe as many as 200. This is based on studies that suggest for every identified case, there are many others that go unrecognized because their symptoms are mild or they have no symptoms at all. Unfortunately, we've also seen 192 deaths in the state, and this includes one additional death in Beaufort County, bringing the total to 10. We continue to remind the public that these are not just numbers, that these are people. The virus is now widespread in our state and in our communities, with all 46 counties with confirmed cases. And when we talk about spreading, it's important to note that the virus is not spreading by itself. It's spread by people and their actions. but our current data shows that social distancing and staying home has helped combat the spread of the disease and is ultimately saving lives. We see early evidence that South Carolina's curve of new cases is potentially leveling out or flattening. To better understand this week, DHEC was joined by 5 CDC staff members. This includes 2 infection prevention experts who will assist our staff in managing nursing homes and long-term care facilities to limit the impact of the virus there. 3 of the members of the team are epidemiologists who will assist us in collecting and reviewing data to better understand the impact of COVID-19 in our state, and we'll also discuss strategies to increase contact tracing, which will be an important part of reopening the state. It's important to remember, even as new cases plateau or later decrease, people will continue to be infected and positive cases will be reported, and unfortunately deaths will continue to occur. Our local data, along with national data, does show that elderly as well as African Americans are disproportionately impacted by this disease. Additionally, people with underlying health conditions are at higher risk of severe illness from COVID-19. We thank all South Carolinians for their individual efforts to stay home, socially distance, and take the other recommended precautions for protecting themselves and their communities to prevent further spread of the disease. And for the latest information, you can visit our webpage, scdhec.gov/COVID-19. And I'm happy to take any questions now.
Okay, Dr. Katka. We have one question here, and this question comes to me from Anna Marie, and it says, "Good morning in Florida. The Department of the Department of Health, set up a remote testing station in the Villages, a huge community of senior citizens. Here in this area, we have Sun City with a population over 15,000 senior residents. Will DHEC or the county approve setting up a remote test site in Sun City? How can we make that all happen?" Is the question.
I can't comment on that specific setting. I do know that we're in discussions to set up more remote testing, to have more outreach with our testing, and to make sure that we're hitting some of these communities that are at higher risk for severe complications. So I know that that's something that's in the works right now.
Okay. Thank you very much. We appreciate you, and thank you for being with us today, Dr. Katka.
Thank you.
Next, we'll be hearing from Jeremy Clark, and Jeremy is the Market Chief Executive for Hilton Head Hospital. Jeremy?
Good morning, Bill. How are you?
Very well, thanks. Good to see you today.
Good to be back here. We appreciate it. As in previous weeks, Hilton Head Regional Healthcare continues to operate effectively and safely. We remain ready to take care of patients if there is a surge, but also ready to provide safe care in our emergency departments and ready to provide safe care in our operating rooms and our imaging centers as well. Just last week, Hilton Head Hospital and Coastal Carolina Hospital resumed the performing of elective surgical cases and elective imaging cases, and we got a great reception for this. We had patients who needed this care, who had postponed this care over the past few weeks, so they were very excited to receive it. We had surgeons who were ready to provide that care, and we had staff that was very excited to get back to work. So it's really good to see our ability to provide that care safely, very positive feeling around our hospitals, and look forward to continuing to grow that over the coming weeks. But we're also very focused on our future. You hear a lot, and I hear a lot about companies talking about the new normal. And I really want our hospitals to lead the creation of the safer standard. Building upon our history of providing safe care already, but finding new ways to do it in this new age. And for us, this can really be summarized into 4 main components of testing, screening, spacing, and cleaning. From a testing perspective, we've been very fortunate to work with DHEC, and DHEC has been able to get results now consistently back in 24 hours. So for any patient that's appropriate in our ER, in our hospitals, or even some surgery patients who are appropriate, we're able to test those and get those results back quickly. Any of our caregivers who develop symptoms on the job, we're able to get those results back within 24 hours, which is great. But we are very excited to be selected by DHEC to receive the new Abbott ID Now system at Coastal Carolina Hospital. This will allow us to provide rapid in-house coronavirus testing really for patients across our community, and should be able to get results back in less than an hour. So we're excited to have this. We're going to start this process this week, but we will initially be focused on those emergent patients where a rapid diagnosis is really critical to their immediate clinical treatment. We will be expanding our ability to test over the coming weeks, but it is important for everyone to remember that right now a physician order is required for testing. And nationally right now, these tests really need to be prioritized for symptomatic patients. But these are very exciting developments for our healthcare system and for our community as well. And we look forward to continuing to communicate to the community as this develops. From a screening perspective, we are maintaining our restrictions on visitors right now. We are really limiting, we really have a no visitor policy with only a few exceptions. And I want everyone to understand that is designed to keep our patients and our staff safe. We've created a very safe environment inside the walls of our hospital, and this helps us maintain that safe environment. So we've limited access into our hospitals through the ER entrances. Everyone entering the hospital is asked about their travel history, they're asked about their health, their temperature is taken, and they're provided a mask. And we can do this because right now we have a more than adequate supply of personal protective equipment. So surgical masks, N95 masks, isolation gowns, gloves. We've been able to secure and maintain ample supplies of that to keep our patients, to keep our caregivers safe. We do have a new focus on spacing. You know, we've been operating all private rooms at both of our hospitals. Our ERs are currently operating in a private room setting as well, again, to keep our patients well spaced from each other. But we've also made new changes to our waiting rooms. So removing chairs from waiting rooms to allow those patients who are waiting for a test, waiting on a procedure, to be able to adequately keep space amongst themselves. We are also placing all potential COVID patients in areas of the hospital away from other patients as well. So we're trying to do more thinking about from a spacing perspective. Finally, we are doing a lot of cleaning. We've made significant investments and increases in hand sanitizer throughout our facilities. Our environmental services staff always do a wonderful job, but we've allowed them to really refocus more on our patient care areas, our direct patient areas, so that we can maintain the cleanliness there. And as more and more of our services come online, our other staff are going to play a role in keeping their areas clean as well. So, for example, our registration staff are now wiping down the countertops in front of them between every patient. They are wiping down their waiting room on an hourly basis to keep those areas clean for patients that are coming through during the day. So we're going to continue to look for new ways to make sure that we're maintaining that safe environment. So with these systems in place, we are providing care at a new, safer standard. And we're going to look for new ways. We're going to implement new actions over time to really build upon that as well. And during all of this, we remain ready to treat that surge of patients if indeed it comes. Again, these are exciting times at Hilton Head Regional Healthcare, and we appreciate the leadership that we're getting from our state and our local officials, and we appreciate everyone's support for our caregivers. So, Bill, with that, I'll hand it back to you.
Jeremy, thank you, and certainly exciting news about the Abbott ID Now, and great report. We appreciate the update. One question comes from Eleanor, and was just wondering if on contact tracing, if any ideas when that might start and how it works.
No ideas on when it might start. That'll be something that I think hospitals and communities will be in very close discussion with DHEC, and also following guidance from the CDC, as Dr. Kaka just referenced, as to how we do that effectively and how we implement that effectively.
Jeremy, thank you. Thanks again for joining us today. We're delighted to have you. And we're going to switch now to Dr. Kelly Buthelay, who's the president of the South Carolina Nurses Association. Dr. Buthelay.
Good morning. Thank you for having me on. So I just want to kind of echo a lot of some of what our other colleagues in healthcare have already said. My perspective, I know that we're starting to ramp up opening the island. I'm going to take a little bit of a cautious approach. I know that everyone is ready to get the island moving forward and opened. I understand that, but we have to be extremely cautious. We have to maintain social distancing. We have to continue to wear masks. We have to continue to practice our cleaning measures and those types of things. I want to really applaud some of the local businesses like Harris Teeter and Walmart and those areas that are, having an entrance and an exit and putting the measures in place to make sure that their employees and even the patrons are staying safe and making sure that people are doing what they're supposed to lower the possible transmission of the virus. We cannot, as islanders and a community, let our guard down. Just because we're moving forward with opening the island in a measured manner does not mean that the virus is gone. We are still seeing cases in the community. As Jeremy just laid out very methodically, we are taking every precaution to keep patients and visitors and healthcare workers safe. We have to go about our business that it's still there and it is all around us. We know that for a fact that people can walk around with the coronavirus and not know it. You can have very mild symptoms. We can have very severe symptoms. But the bottom line is we all have to do our part to make sure that we continue to get to that flattening of the curve. And I am happy to see more people wearing masks. We are starting to see less people at the grocery store at a time, but we still have to make sure that we tell everybody, wash your hands, use sanitizer, don't congregate, don't take the opening as a free-for-all that, hey, we're out of the woods, let's go, have wild parties and, do crazy stuff. We have to do this very smart or we will be going backwards. And, there are healthcare providers and other people, EMS and other people that are at, we keep calling them the front line, but they're really the last line, because if we ramp the coronavirus back up, that's who everybody's going to see. And we don't want to be in a position that we do have a surge because we weren't really smart about it. So please, everyone that's on this call, don't forget that we have to be cautiously optimistic and that we don't do things that put us in going backwards. I want to also echo what Jeremy said about the testing. There is, I get asked all the time about testing. There are no areas that you can just go up and get a test because you want to test. And testing is really frustrating for a lot of people. There are criteria for testing. And unless you have symptoms or have been exposed, you're not going to just be able to go and get a test. And I know that's frustrating for everyone, but that is the reality of the testing. Testing has been probably the big Achilles heel for a lot of us. But unless you have a reason to be tested, you probably won't be able to get a test. Hopefully that will change. There's a lot of things that are changing about testing. We are working with DHEC and the CDC, and as everyone knows from the news, that is a source, that is a thing that changes daily. But just know that this area does not have a drive-up testing center. We would love to see more testing, but that's not something that's just happening. So I echo what Jeremy said about, you can be tested in the ER if you have criteria for that. If you are if you're a patient and you come to one of our ERs, you would have to meet the criteria. But we all have to do our part to make sure that when we do go out into the public and use the parks or the beaches, that we do so in a very mindful, social distancing manner, and continue to do our part to flatten our curve. And I'll take any questions or comments.
Thank you, Dr. Boothele. One question comes from Chris related to testing. When will we have an antibody test available for those that may have already had symptoms but are better?
That's a great question. I can't answer that because the antibody testing isn't a foolproof, or it's, there's some controversy about whether or not that is actually a surefire way to know that you actually have had the test. I just actually read a study either yesterday or the day before that it is not I don't know how to put this. It is not actually been proven that it is absolutely 100% that you have the antibodies, and that means that you can't get it again or that you've actually had it. There's a study at Columbia University that's taking people that have had COVID and had evidence positive COVID test and now antibodies, and it's only at about 60%. So I don't know that we're actually going to get that testing available here. I am not an authority on it, but I don't know that it's going to be widespread here. I don't know if DHEC will have more information on that, or the CDC. But at this point, I think we should be focusing on getting COVID testing before we get antibody testing. But I don't think there's any guidelines on widespread antibody testing and where it fits into return to work. I think this is a very hot topic and a very controversial topic because, again, you have to make sure that the test has a high sensitivity and a high specificity. And I don't know that we're actually there yet. I don't know if that answers the question.
It did. Thank you. And thank you for being with us today again. We appreciate you sharing your knowledge, and we're glad that you're on our team.
Thank you so much for having me.
As we wrap things up today, one, I'd like to remind businesses that if you're deemed an essential business, the reentry application for after a hurricane, the biannual pass, have to be submitted to Sheriff PJ Tanner by Thursday, April 30th. So this Thursday, if you need to submit that, please do so as a reminder. And then once again, I'd like to certainly say thank you. Thank you to all of you for joining in today as we continue to navigate these unprecedented times. We continue to learn from the challenges that we're going through, and we certainly have the opportunity to come back and with the goal of being stronger than where we were before. So we're all looking forward to that, to better days, and together we will see better days, hopefully in the very near future. I thank you all again for joining us. Look forward to having you on the next call, which will be next Wednesday for our next update. Have a great day. Goodbye.